To our Leeds clinic, and I'm delighted that John has joined us here today. John has had CML for 20 years, is that right? Recent anniversary.
Yep.
So he is very well placed to talk to us about his experiences of living with CML. So first of all, John, I wanted to talk to you about the time leading up to your diagnosis and how your leukemia was picked up.
Could I just apologise first before we start? I can't compete with Roman Reigns.
You don't need to.
The name John Marsh doesn't quite have the same ring to it. So I was diagnosed on the 2nd of August 1999. I was in my mid to late 30s. Hadn't got a clue what leukemia was, and very rarely had visited a doctor, to be honest. So I was very much, like as somebody said earlier, thought nothing could happen to me really, and didn't go to doctors. I'd had glandular fever as a student, and came back very ill from a backpacking trip to Turkey. But apart from that, I thought I was untouchable. I had an enlarged spleen. I had sort of some of the typical symptoms, I think, night sweats, low fever at night. I was about to go to France on holiday, and I thought I'd better get this checked out. And the doctors basically said, something wrong with your blood test, can you come back on Monday to the hospital? When I went to the hospital on Monday, it was quite a big shock, because I think the haematologist in Northallerton, before a bone marrow test was taken, thought I had maybe acute leukemia, because I can certainly remember him saying, you may have weeks, you might have months of anything you want to do in life, you better do it now. So that was obviously a major shock. Threw me for six, I guess, really, but I was extremely fortunate that I recovered my blood count, normal blood counts, very quickly on hydroxyurea, I think. Mm-hmm. Which was then combined with interferon.
And how did you find the early days of that treatment?
Interferon I was on for 2 years. I found it tough, to be honest. Interferon gave me sort of flu symptoms quite a lot. I also felt that it maybe interfered with my central nervous system. I had some acute panic attacks around 2000, 2001. I volunteered for an experiment at the time to combine interferon with cytarabine, which was a low-grade chemotherapeutic drug. Yeah. I found that really tough, and it made me quite ill, and after 5 months I asked to come off it. At the same time I developed bowel cancer, so I was operated for bowel cancer on 9/11. So I had a sort of double whammy in my 30s.
And here you are.
Here I am. So maybe before, if I don't want to put anybody to sleep, so I think I'm sort of thinking about what could be useful about my story for anybody who's been recently diagnosed or is thinking about taking part in a coming off treatment experiment. And I think there's 3 reasons. A, I'm still here, 20 years. During the break, I've just met a gentleman who was diagnosed in 1993. And I think this is really useful if you meet people who've been had the disease for a long time. Secondly, I would say because it took me a long, long time to achieve molecular response. My years on interferon, 2 years on interferon, I didn't really get much of a cytogenetic response, minor, which I lost when I had bowel cancer, which is really the reason I got accelerated onto Glyvec, I think, back in November 2001.
We talk about Glyvec.
Yep.
I found a lovely quote in your notes from Graham Smith, my predecessor in Leeds, saying the emerging story regarding the new agent, STI 571, which is the name for Glyvec then, which was announced at a plenary session at the American Society of Haematology conference, is encouraging, but it is far too early to say what its role will be in the treatment of CML. So, do you remember the buzz about imatinib?
I do, because I was always, one of my responses to having this diagnosis was I thought I've got to engage my mind. I'm sort of a rational person really, and I like reading about things. So I had read up about STI 571, and I think I badgered Dr. Smith into letting me have a go. I can remember one of the early things I did was went out and bought a textbook on haematology.
Not essential.
I can absolutely assure you I didn't understand very much. But the important thing for me was that I was engaging my mind, or taking possession, I would say, of this condition. You know, it wasn't something out there that was extraneous to me. It was now part of my identity, and I had to engage with this. And at least trying to understand was the important thing. You know, it wasn't whether I understood or not. It was making the effort, I think.
How did you find side effects on imatinib?
Well, imatinib was a complete transformation for me. Two things, really. Firstly, the quality of life. I hadn't been able to do any sport, really, while I was on interferon. I can remember, while on interferon, going for a walk in the Dales here in Yorkshire, 12-mile walk, and after 6 miles I could barely walk. I was sort of pigeon steps for hours to complete this course, and a friend of mine thought I was having a laugh, but I wasn't. I couldn't move. So Glyvec was almost instantly a massive improvement quality of life. I got back on a bike, started doing exercise, and also, of course, I had a cytogenetic response at last. So I got, within 9 months of Glyvec, I had a complete cytogenetic response. Yeah. There was no molecular testing at that time. I think it was back in 2001. Yeah.
And then you moved on to a very good molecular response, which was maintained for a good number of years, albeit that it took you a long time. And as you say, you
I think
found,
it took me 7 years to get there.
That sharing the stories of hearing other people who've similarly had a long time to get into remission was helpful. So moving on to 2015, you were invited to consider participation in the UK stopping study, Richard's at the back there, the study called Destiny, which was designed to halve your treatment for a year with a view to then stopping. So having perhaps viewed imatinib as a genuine lifeline, how did you feel about the prospect of reducing or stopping?
I had some concerns and worries, because the image I'd built up in my mind about imatinib or TKIs was a bit like building a dam wall, and we quite effectively built this dam wall for me. Things well under control, and I was thinking, well, maybe if we stop the treatment completely, the water will overflow and be difficult to put the dam wall back again. Hard to put the genie back in the bottle. So I was worried about that, but to be honest, I'd read one or two things. I think there was a case study in France and another one in Australia. And the evidence was that if you relapsed or had to go back on treatment, then it was pretty universally all patients recovered their previous recovery status quite quickly. So I was willing to take that risk. I thought it was better to be drug-free if possible. So I tried. I think it was, so the first year was semi-dose, and I was great. There was no real major change, I don't think, in my counts. I think it was 20 months altogether off treatment that I eventually had to go back onto the Glyvec.
And did you feel better when you were off the drug?
When I was off the drug, I did a marathon walk across France, which just happened to coincide, and I probably was lucky, really, that it coincided with not being on treatment. So I think I can identify with some of the classic side effects that have been mentioned today. I have quite a lot of cramp, indigestion problems, I would say, actually. So yeah, being off the treatment, I think I was probably at my peak fitness. But I've been very lucky. I've personally been very lucky with the imatinib. That I don't think my side effects have been that bad, really. Pretty good.
So as you say, there was a period of really several months where your PCR levels were just on the creep and fluctuating. Some would be better, some would be a little bit up, a little bit down. But it started to look increasingly likely that you were going to need to restart. How did that feel?
I wasn't totally surprised, because the fact that I'd been on, I think I must have been one of the first people on imatinib in this country, one of the earliest ones. I started in November 2001. So that I felt the fact I'd been on this for a long time, it took me a long time to achieve a major response. I'd always seen Glyvec as a question of control rather than cure. and I was kind of happy with that deal. So for me, going on this experiment Destiny trial was, let's see what happens. Hope it goes well. I wasn't terrified of it failing. That seemed to be part of the deal, really. It was control rather than cure was important for me. I'm quite happy with that. I was a bit worried about, that damn wall. Can we? Am I going to get my response back? Because my situation before the trial was excellent. I was in a fantastic position really before going on this, so it was a risk. But I was confident in what I'd read and what haematologists told me that there was, I should be able to recover my previous response, which is in fact what happened very quickly, I would say.
So going into the trial with sort of realistic expectations about the chances of staying off drug perhaps helped you. There have been some patients who've said they really felt very devastated when they had to go back on drug again.
I didn't feel that, and I come to one of these days. I used to come to these days many years ago when I was first diagnosed. I think I've gone a bit complacent since. Might be good, might be bad. And I can remember a very early one. I think it was Dr. Hollyoak. Mentioned something called Glyvec holidays. This was back in 2002-ish, I would think. The idea of taking a break, somebody else has mentioned that this morning, take a break from the treatment. And I had the image of a boxer, really. I can't compete with Roman reigns, but the idea was, let's knock the opponent onto the canvas and then let him get back on his feet, stop the treatment, let him back up, and then smack him again. And that was an image in my mind of what we were doing, So if we attacked the disease again a second time, it might be more effective than had I not taken the break. Yeah.
So for people who are advised by their consultant that they are fortunate enough to be in a position where it may be safe to contemplate reducing or stopping their drug, would you recommend that they would give it a go?
My experience is positive. The monitoring is excellent. I was monitored every month. I felt treated quite special, really. And as I say, the evidence. I mean, I'm the patient, but the evidence I received from the experts was that if I needed to go back on treatment, I would recover my previous response immediately. And I think if you look at my graph, you would see that as soon as I went back on Glyvec in November 2017, so nearly 2 years ago, the graph goes right back down.
Yeah. And we had good news in clinic yesterday that the latest spot is even
I'm one of these people who's data obsessed, so I do keep meticulous records of my blood counts, and I knew where I wanted to get back to, and yesterday was it. So.
So overall, how do you feel now living with CML? As you say, part of your life now?
Yeah, I mean, there are concerns because I think, on one hand, there are concerns because the experts know what an imatinib patient looks like after 20 years, but I don't think anybody knows what they look like after 30 years. So what could come down the tracks? So there's a slight worry about that. But I think two things encourage me. One is my quality of life. I play competitive squash. I play in a York League of squash. I get a lot of cramp, but I can do it. I'm very fortunate that way. Quality of life is excellent. I think I take my sort of major life decisions like a person who did not have leukemia. It doesn't impinge on my major decisions. And secondly, I would say, and it's all been, all the evidence this morning, just the sheer pace of progress of the science. My own story of 20 years really is the story of an astonishing acceleration in knowledge and treatment of this disease. So, that's where I'm in a good place. Yeah.
That's tremendous.
I didn't get to mention my heroes.
Ignore these wrestlers.
When I was diagnosed, when I was first diagnosed, one of the things that basically helped me was I'm a big Lance Armstrong fan. Use the present tense. I was and I still am a big Lance Armstrong fan because he was an inspiration to me, and I think he had 9 1999 I was diagnosed. 1999 I think was the year he won his first Tour de France. Okay, he's now condemned as a drugs cheat, but we tend to forget the massive work which he did for the cancer community. And
so
reading
Lance Armstrong, I'm sure you know, but had extensive testicular cancer with metastases in his brain, his lungs, and made an astonishing recovery.
Yeah, so there's one line in the book. He wrote a book called "It's Not About the Bike," and of course we found out subsequently it wasn't about the bike. But in "It's Not About the Bike," there's one line where he says he talks about getting sort of cold or flu symptoms and how this put him into panic mode. And he'd rush down to his doctor to get his blood checked. And I'm thinking, oh, this is fantastic. You know, it's okay to freak out about this stuff because, you know, the great Lance Armstrong, fantastic hero of endurance sport, whatever you think about the techniques he used, still a miracle what he did. And this guy who's got a, you know, fantastic mental strength can get freaked out by you know, cold or flu symptoms. That was a great help to me in the early years of dealing with leukemia, really. It was okay to get a little bit obsessed and a bit
worried.
Yes,
yeah. And that's the value of sharing stories and sharing experiences,
so.
Absolutely, and that's partly why we're all here today. And extremely grateful to you, John. Thank you very much.
Thank you.